Good evening, everyone. Today, we will discuss why genetic information should be used in hiring and employment decisions in African countries. We, the Affirmative Team, Augustine and myself, Sarah Musallam, will present real-life examples and research that highlight the benefits of this practice.
Genetic and genomic policies have advanced greatly over the decades. However, genetic information are most times concealed due to discriminative tendencies. If genetic information could be used to individualize treatment as far as diagnosing and targeting malignancy, our stance is clear. We support the use of genetic information in employment decisions in Africa. This practice can lead to safer workplace, better job matches, and significant cost saving, all of which are crucial for the development of African countries.
Firstly, using genetic information can significantly improve workplace health and safety. For example, in South Africa, many companies have used genetic testing to identify workers at risk for cirrhosis, preventing the development of this occupational disease. Similarly, research for the University of Cape Town has shown that certain genetic markers can predict susceptibility to tuberculosis, a major risk for healthcare workers across the continent.
Secondly, the use of genetic information in employment decisions increases productivity and job fit. As such, genetic data can be used to match employees with roles that suit their genetic profile. For example, in Kenya, a pilot program in the agricultural sector identified workers more resistant to pesticides, hence optimizing their job placement and enhancing productivity. Additionally, a study in Nigeria found out that genetically informed job placement in high-stress environments such as the oil and gas industry reduced turnover time and improved job satisfaction.
Thirdly, genetic screening can help prevent economic burdens on employers. For instance, companies in Ghana that implemented genetic testing to manage chronic conditions like sickle cell disease reported reduced healthcare costs and absenteeism. In South Africa, genetic screening in industries like mining and construction has lowered workplace accidents by identifying workers at risk for cardiovascular conditions.
Lastly, genetic information allows for the creation of personalized wellness programs. A practical example was found in East Africa, to be precise, Mauritius, where a government initiative offering genetic testing led to tailored diet and fitness plans that reduced diabetes incidence among employees. Similarly, in Tanzania, genetic screening for cardiovascular risk allowed for tailored interventions, decreasing absenteeism in high-stress sectors such as in banking and in health.
While concerns about privacy and discriminations are valid, we believe that these can be effectively managed with strict legal frameworks and robust anti-discrimination policies. For example, the African Union's Model Law of Medical Ethics includes provisions for protecting genetic information, and South Africa Employment Equity Act prohibits genetic discriminations in employment.
Now, in conclusion, the use of genetic information in employment decisions, when done responsibly, can offer substantial benefits. This has been achieved in US, China, some parts of Europe. Some countries in Africa are already testing it out. We strongly believe we can replicate the same across Africa. We are also convinced that this approach will enhance workplace safety, productivity, and economic efficiency, hence contributing to the overall progress of African countries. Thank you.